one of the biggest things is qualifying for the surgery. So with a BMI of over, I think they say a BMI over 30, you already qualify. My BMI was like 56. So that was, it was not a question of whether or not I qualify for the surgery, but if my body could handle it in terms of my lupus and everything like that. And one thing that they didn't tell me until the week beforehand is you cannot take a pill bigger than your pinky nail. My pinky nail isn't a good representation right now because I have nails on, but this is how small the medication is supposed to be that you're supposed to be able to swallow after surgery. I was on kidney medication that was this big. All of my magnesium supplements. Yeah, magnesium supplements are huge. Multivitamins are huge. And so I started freaking out like a week before the surgery because I was like, what am I going to do with all my medication? And they all told me, I think you're a little too scared about what's going to happen. We will figure that out when it happens, because in order to play around with the medication, they have to see the blood work and see how I'm doing afterwards. And so, long story short, I ended up getting off of all of my blood pressure medications and all of my kidney medications because of how well the surgery worked for me. It was after the first week, I was feeling lightheaded, and I was like, why am I feeling so lightheaded? Like, I can't get up without feeling dizzy. It's because my blood pressure was tanking because I was taking my medication. And so my doctor was like, yeah, just stop taking it. I'll see you in a week. And she was like, yeah, your blood pressure is completely stable. It was 1 week after the surgery. It was like, it felt like magic that it just happened all of a sudden. So that was part of the prep was for my insurance, we had a 3-month course that we had to go through. I had to go through cognitive behavioral therapy. I had to go through nutrition classes, and I had to do an exercise program. So that's not necessarily for every surgery, but for insurance to cover it for me, that's what I had to do. Mine was completely covered by insurance because I was able to go through all those steps. But I do know people who have gone to Mexico to do it because it's easier and they don't have to do all those requirements, and it's, $5,000 to go do it there. Or there's another type of surgery that's not as covered by insurance, called the duodenal switch, which is a newer technology that is also you have to pay for out of pocket. So that one is about $12,000. So I am very lucky and very fortunate that I have the insurance that I do have now. Like I said, it was all just like a perfect situation for me to be able to get the surgery done. So for that, I'm very thankful. And yeah, I had to get clearance from my rheumatologist, but she said she had no qualms of me doing the surgery. I've been in clinical remission for about 2 years now. And so she was like, this is the perfect time. And also it ties into me wanting to start, family planning soon too. And so we've all felt like it was the best situation for me to get the surgery done first so that I can be healthy enough to house a little baby. So that's a little bit about my preparation. The reason, like I said, was because of how heavy I got, a lot due to the prednisone and a lot due to being in so much pain to not be able to work out the way I would want to. But yeah, I think the preparation in terms of my AiArthritis disease was just making sure I was in remission long enough to withstand the big change on my body.
That makes sense. That makes a lot of sense. As far as my preps go, each one of them was a little different, but historically the biggest thing that was required of me each time was that I had to be off my Celebrex, so anti-inflammatory medications, and I think it's for a full week before you even have surgery. And I also had to be off my hormones because of my severe hot flashes. So I had to go off of my Premarin and the Celebrex, and there was other tweaking with, it seemed like with each surgery, and also requirements. some surgeries, they required that I have an EKG and have my chest x-ray and all these other different procedures, to again, have all your ducks in a row prior to having surgery. And seeing, so now that, of course, with all the other problems, I'm now seeing a cardiologist and all of those things. So it snowballs in you having to touch base. And again, managing your own care, you need to make sure you're touching base with every one of your doctors so everybody has equal input. Because when I had my knee replacement, my surgical pain management was horrendous. And it was to the point where I cried for about 48 hours straight because they would give me nothing more than like a Percocet or a Vicodin. I'm like, can you please look in my chart to see that I am not a standard patient? And that was probably the worst part of it. And as far as preparation goes, that, and again, that part of that recovery was horrendous. And it definitely empowered my husband, because my husband could only spend so much time in my room because I was just bawling, and PT and OT would come into the room and walk right back out. They're like, we can't even touch her. And again, not doing really good things for my joints and everything like that. So those are some of the things that I had. And it is mostly because of all the medications that we're on and tweaking things and making sure that they're keeping fine tune of blood pressure. That was another thing during COVID. I had both reconstructive surgeries done, and my blood pressure was incredibly high. And I had been talking about it for a long time. I'm like, this is not normal. And I'm like, I don't want to have a stroke, because it was close to 200 over 108. And I could have stroked out, but they kept saying, oh, what, you're in pain. And I'm like, yeah, I'm always in pain. That isn't a reason for my blood pressure to be that high, which caused eye damage. And now it took over a year and 3 medications later that now I've got my blood pressure under control. But now I'm seeing a cardiologist because of all the other issues that happen. I love it.
Story of our lives.
Yeah. But we've got to be really big advocates of ourselves too. And again, not take no for an answer. I kept getting poo-pooed, even though I kept bringing it up, and it wouldn't show up in my follow-up notes. And I'm like, but we talked about it. So that's kind of like a really quick synopsis of some of my stuff that I had prior to surgery, and like preps and things like that.
And I think that's the perfect place for me to kind of piggyback into mine, is that idea that you have to be an advocate for yourself. You cannot take no for an answer when you know that something is wrong. Trust that. And
Yes.
if the doctor that you see doesn't want to listen, the doctor that you see doesn't want to act, then that is when it's time to find another doctor, because no one is going to look out for you better than you. And no one knows what's going on inside your body better than you do.
100%.
And so,
Fired many a doctor.